Americans are overdosing on a drug they don't know they are taking. CNN, fueled by the coronavirus pandemic and an increase in fentanyl use, the US drug epidemic exploded while Americans were locked down. From May 2020 through April 2021, more than 100,000 people died from drug overdoses in the US, according to provisional data released Wednesday by the US Centers for Disease Control and Prevention. That's the horrible new record for drug overdose deaths, a near 30% rise from the same period a year earlier, and the year doubling over the past 5 years. The drug epidemic grew in tandem with the COVID 19 pandemic, which claimed about 509,000 deaths in the same period. Synthetic opioids like fentanyl, a painkiller 50 to 100 times more potent than morphine, account for the bulk of those drug overdose deaths, around 64,000. The pandemic played a role. In a crisis in this magnitude, those already taking drugs may take higher amounts of those in recovery may relapse. It's a phenomenon we've seen and perhaps could have predicted, Dr. Nora Borkov, director of the National Institute on Drug Abuse, told CNN. Enough fentanyl to kill 333 million people. Read this line from CNN's report. The US government has seized enough fentanyl this year to give every American a lethal dose. Drug Enforcement Administration Administrator Ann Milgram said Wednesday at the White House press briefing, calling the overdue epidemic in the U.S. a national crisis that knows no geographical boundaries, and it continues to get worse. Deadly fakes that looks like prescription pills. Illegal drugs are often made to look like prescription pills, available online and sold through social media, according to the U.S. Drug Enforcement Administration warning in September. That same month, the DEA announced more than 800 arrests and the seizure of the more than 1.8 million pills as part of the 2 month sweep. The agency noted fentanyl has been seized in every state, and it issued an urgent warning in September about fake prescription pills laced with the drug. A scant 2 milligrams can be deadly, and they are often coated with counterfeit oxycontin, Percocet, or other drugs. Who abuses drugs? Lots of people. An estimated 10.1 million Americans aged 12 and above misused opioids in 2019, including 9.7 million prescription pain reliever abusers and 745,000 heroin users, according to CNN's reporting. Who is dying? The Google search yields scores of stories like these. There's a 28-year-old man in North Carolina who died after taking a fake pain pill that contained fentanyl. There is a 11-month-old baby left unsupervised in North Carolina who died from the fentanyl overdose. Her mother and grandmother are facing charges. While searching on Google for specific cases of fentanyl deaths, I saw reports on a lot of toddlers eating their parent pills. A 15-month-old's father father charges in his overdose death in South Carolina. A mother of a 1-year-old in Alabama arrested after the child overdoses. There is a family of the prisoner in Alabama who died of a fentanyl overdose but didn't find out until months later. There is a teenager outside Los Angeles who bought what he thought was a prescription painkillers from the friend of the friend and died from fentanyl poisoning. There is a 25-year-old woman in Las Vegas who thought she was buying Percocet but died after taking fake pills with fentanyl. The stories are everywhere. Where are they getting the drugs? Look at these two stories from Las Vegas. The 27-year-old man is accused of selling fentanyl-laced pills over Snapchat to a 32-year-old man who died of fentanyl toxicity. A 21-year-old woman who went by the Snapchat user name Young Drug Addict was charged with a second-degree murder for selling fentanyl-laced pills that killed a woman of the same age. What does Snapchat say? In October 7th statement on its website, Snapchat argued it is improving its work with law enforcement and using artificial intelligence and report from the community to identify and remove the drug dealers from the platform. How does the fentanyl get the U.S.? Chemicals used to make the drug are often shipped from the China to the U.S. or Mexico for production by drug cartels in Mexico and then smuggled to the U.S. The drug can come in small-mailed shipment of less than a kilogram. The Chinese government crackdown on fentanyl has slowed this method. India is another source of fentanyl in the US. Here's a passage from the DEA's fentanyl report. Fentanyl is being mixed in with other illicit drugs to increase the potency of the drug, sold as powders and nasal sprays, and increasingly pressed into pills made to look like a legitimate prescription opioid. Because there is no official oversight or quality control, these counterfeit pills often contain little doses of fentanyl with none of the promised drug. What is President Joe Biden doing? The administration notes it put $4 billion in funding from the COVID-19 relief package known as the America Rescue Plan toward combating overdose deaths, including expanding services for substance use disorder and mental health. Biden told reporters Wednesday his administration is also working to make health coverage more accessible and affordable for all Americans so that more people who need care can get it.